So what is sty? Sty is nothing but a bump which is seen along our eyelids, either on the upper lid or the lower lid. And it is nothing but the inflammation or infection of an oil gland. These oil glands are the tiny glands which are present between our lashes, and they are responsible for producing the outermost layer of a tear film, which is oily in nature. So for some reason, if we are not giving enough rest to our meibomian glands or the oil glands, these can oversecrete or get infected. The reasons being dehydration, increased screen time, repeated change of glasses, diabetes, or just a high sebaceous secretion in the body. In patients who have dandruff issues, acne issues, and more sweating issues, those patients are more prone for it. I have seen of late a very high increase of sty in young kids and in IT professionals because they are on very high screen time, and probably the lid hygiene is not all that great because they don't take frequent breaks, their eyes go dry, and when dryness happens, these glands are forced to secrete more oil or the tear film or the oily layer of the tear film. So if it happens, what are the treatment options? The treatment options are that we treat the infection by doing some warm compression, some antibiotic drops, some systemic antibiotics. And if this sty does not limit itself where it is, it can actually cause cellulitis around the eye. So when you have these symptoms, please reach out to oculofacial plastic surgeons for the correct treatment, because it's just more than a bump which is present on your eyelid. What happens if sty is left untreated? If it is left untreated, what happens is either it will shrink on its own and you may not get anything at all, or this sty kind of causes a fibrosis or a reaction around itself and becomes like a hard peanut-sized bump, which we call as chalazion or chalazion, and that kind of stays. And if you are in that stage of a disease process, then of course we need a little more than medical treatment. Based on the stage which it is present, you may either need something to be put into that lesion to break it, or a very, very minor surgery called the incision and drainage or curettage of this lesion called chalazion or chalazion. So please don't neglect these lumps and bumps. If you have them, just don't take quick fixes like some antibiotic drops or something over the shelf yourself. Please come to your oculofacial plastic surgeon because they specialize in the disease processes around the eyelids. They understand the disease process, and then we can handle it in the most scientific manner.